It's robbing a lot of calcium from that bone and creating osteoporosis, which is a lack of certain minerals in the bone. And now the bone is going to be very porous. It's going to have holes in it. But at the same time, you're going to have a lot of calcification in the arteries, in the soft tissue, all because the parathyroid hormone is working like crazy in excess. They call this a secondary hyperparathyroidism, excess secretion of the parathyroid hormone by the parathyroid gland in response to low calcium. Your joints are filling up with this calcium. Other causes can stem from a vitamin D deficiency. Low vitamin D causes low calcium and causes the parathyroid to go haywire. Why am I making such a big deal about this point? Because most doctors are afraid of vitamin D because they think if you give too much vitamin D to a person, it's going to develop a toxic effect. This is another confusion. First of all, I haven't found any type of clinical data to show that's true. If we add this additional data of adding vitamin K2 to help mobilize calcium from the arteries, and more importantly, adding magnesium when we take vitamin D3, because magnesium is literally the regulator of this excess calcium. Magnesium alone prevents so many cardiovascular problems. Magnesium removes excessive calcium to allow the normal contraction, relaxation, and your arteries have contractile tissue, and they're able to relax as well. I want to circle back to this vitamin K2 for a second, because vitamin K2 actually helps remove calcium from the arteries as well, then removes the calcium and puts it deep into the teeth, into the bone. It makes the bones really, really solid. But you better take vitamin D with K2. Why? If someone is chronically low in vitamin D3, what's going to happen is the arteries are going to be more susceptible to inflammation, plaque, hardening of the arteries. And I'm not even talking about the arteries of the heart. I'm talking about peripheral arteries through the entire body. That's one of the biggest risks for amputation of the lower part of your extremities, your feet. Vitamin D can potently protect the arteries. They'll help the arteries become less inflamed. They will support the vascular cells for nitric oxide combined with vitamin K2 and magnesium. You can really keep that calcium from developing in the wrong place, the soft tissues. If I personally had high blood pressure, I would be taking 30,000 IUs of vitamin D3 every single day. The best source of vitamin D is the sun. But of course, it's hard to get enough sun. In the summer, when you can get sun, make sure a good part of your body is exposed to sun. About 40 minutes in the sun will give you 20,000 IUs of vitamin D3, which is not a significant amount if you look at the toxicity of just that sun exposure, because even some lifeguards that are exposed to the sun, they'll get about 100,000 IUs of vitamin D3 in a given day. The whole point is to get as much sun as you can without burning yourself. Get slightly pink and then come out of the sun so you can develop a tan. But that regular exposure is really, really important, especially in preventing high blood pressure. If you already have high blood pressure, you should try the combination of vitamin D3 with the magnesium in K2 and just see what happens. Check with your doctor before implementing anything that I have to say, because I'm not trying to bypass your doctor. I'm just trying to educate you on some additional things that I think are really, really important. Thanks for watching.